Welcome to Medtronic's webinar for patients who have started in auto mode. My name is Jen, I'm a certified diabetes educator, and I'll be your host for today's webinar. This webinar does not replace your auto mode training and is meant to provide additional support for patients already trained on and using auto mode. Before we begin, I'd like to share with you an important safety message. Please take a moment and read through this information. We would like you to be as successful as possible, so today we'll review the goal of auto mode and then share some commonly asked questions, as well as some tips for everyday life. Auto mode was designed with safety in mind, and although it uses a target of 120, really the goal is to increase your time spent between 70 and 180 without increasing your lows. Would you like to know how much time your glucose levels are in range? You can look that up in your insulin pump right now. It's easy. Press select, arrow down to options and press select, arrow down to history and press select, arrow down to sensor glucose review and press select. Then select the days to average, like 7 or 14 days, and select next. Here you can see how much time you're spending between 70 and 180 and above and below. This is a great way to know how you're doing. You might also notice that you're spending too much time below or above target. If so, talk to your doctor about this. Now that you know how much time you're spending in range, let's get some of your questions answered. Here are some of the most often asked questions we hear from people who are new to auto mode and some tips for everyday life. You may be wondering, how does auto mode work? Well, the pump calculates and delivers insulin every 5 minutes. We call this insulin auto-basal, which are the pink dots at the top of your CGM graph, and the auto-basal is based on some key information. Your sensor glucose reading and its trend. The pump takes into account not only what your SG reading is, but also how fast it's moving and how long it's been away from your glucose target. The pump also takes into account how much insulin is already in your body still working to lower your glucose. The active insulin you see on your pump screen is the bolus portion. Every 5 minutes, these factors are taken into consideration. Auto mode was designed with safety in mind. It takes into account your past 6 days of insulin needs, and it also adapts every day at midnight. The goal is to safely maximize your time spent in target range while preventing lows from the over-delivery of insulin. Now that we've explained what auto mode does, let's explain what it does not do. Auto mode does not dose off of patterns. You may be someone whose glucose rises most mornings as soon as you wake up. Auto mode will not proactively decide to give you more insulin at 6 a.m. every day, because what if you don't need extra insulin every day at 6 a.m.? You wouldn't want your pump to decide to give you extra insulin every day because you'd go low the day you didn't need it. That's what's so great about auto mode technology. It adjusts based on what you need at that moment. Auto mode cannot correct for large dose mismatches. If you bolus for the carbs you plan to eat, but for some reason end up not eating, auto mode is not built to correct this mismatch. In this case, you would need to intervene. Auto mode doesn't know what you're eating or what you ate in the past. If you're eating your typical breakfast meal, auto mode doesn't recognize this food and it will not remember it the next time you eat it. Auto mode will adjust your basal levels after eating. Look at one person's glucose levels, the blue line, and corresponding auto-basal, the pink line, for 4 consecutive nights between 12 a.m. and 3 a.m. Each night, every 5 minutes, the pump significantly adjusted the amount of insulin it delivered to keep this person's glucose levels within target range. Now imagine what this person's glucose levels might look like if the pump wasn't capable of adjusting insulin every 5 minutes. Some of you may have noticed improved control since starting auto mode, and some of you may be asking, why am I not 120 more often? Your healthcare professional or Medtronic rep may have told you that auto mode is aiming for a target of 120, but you should expect to see glucose levels that are higher and lower. Also, some of you may be used to a lower glucose target and aggressively correcting high BGs. Auto mode is designed for safety and to safely lower you to target. Ask yourself, are you having fewer lows? Are you spending more time in your target range?
Remember, an average glucose of 120 translates to an A1C of about 6%.
You may wonder if you need to calibrate after you get a BG required alert. Just a friendly reminder, a BG required alert is to stay in auto mode. Calibrations are to ensure you continue to receive your readings and to make sure those readings are accurate. If you happen to get a BG required alert and it's also time to calibrate, go ahead and use the blood glucose for a calibration. But you do not have to calibrate every time auto mode asks you for a BG. When might you not want to calibrate? If your glucose levels were changing rapidly, say you saw 2 or 3 arrows on the screen, you may not want to calibrate. What if you get a calibrate now alert? You'll want to calibrate to continue to receive sensor data. Why do I get repeated BG required or calibrate now alerts? Let me remind you that the number one concern in auto mode is patient safety. Auto mode checks each BG that is entered, and requirements are stricter than those for CGM alone. So if you get a BG required after you've just entered one, it means the first BG was not accepted by auto mode and the system requires additional BGs. If you did not calibrate on the first BG request, you can use your BG to calibrate your sensor. It may help to wait 30 to 60 minutes before rechecking and entering another BG or calibration.
You may receive additional requests to calibrate now, especially on day 1 of wearing a new sensor.
This is normal, and it's your pump's way of making sure your sensor is performing well. So spread your calibrations throughout the day and calibrate your sensor with your pre-meal BGs as well as before bed to help avoid nighttime alerts.
What is safe basal?
When the system determines it may not be safe to continue to adjust your insulin based on your SGs, auto mode uses a fixed basal amount called safe basal. You'll notice a gray and white shield on your pump screen. Know that you're getting a fixed amount of basal based on your recent insulin needs. Safe basal is not using your SG to adjust the amount of insulin you're getting because your SGs may not be available or reliable at that moment. Lastly, if the reason why safe basal occurred is not resolved within 90 minutes, the system will exit to manual mode. Rest assured that safe basal may resolve on its own. But if there's something you can do, like enter a BG, your pump will let you know. Simply clear the alert and follow the instructions on the screen. What are some of the reasons you can go into safe basal? Your pump is not communicating with the transmitter, like perhaps a lost sensor has occurred, or perhaps your BG and SGs are too far apart, or perhaps your pump has been delivering your lowest or highest basal insulin for a period of time. Your pump is smart. It has checks in place for sensor and insulin delivery, which is why your pump shifts to safe basal at times. The most important point is you do not need to memorize the reasons for the alerts, but simply follow the instructions on the screen.
What do you do when auto mode exits?
Well, first know that your manual mode basal rate automatically starts. But once you're exited from auto mode, it's a smart idea to go to the auto mode readiness screen to see what you can do about getting back into it. The auto mode readiness screen is one of your status screens. And if there's something you can do, then take the appropriate action. Take a look at this person's auto mode readiness screen. We see a question mark next to BG required. This person should check his BG to get back into auto mode. If this person were to see the updating icon, the shield with 3 dots next to the sensor not ready, then there's no action to take. This person must wait until a sensor is ready to get back into auto mode. Having more exits than you'd like, or think you're not spending enough time in auto mode? Most often you have to read your pump screen and respond, but perhaps you're not getting alerted. Check your auto mode BG alert and make sure it's on. You may have turned it off accidentally or on purpose. If so, we recommend that you turn it on since the goal is to maximize time in auto mode. That way your pump will beep or vibrate when a BG is needed to get back or stay in auto mode. To check that it's on, press select, go to options and press select on Smart Guard, then press select on auto mode. Arrow down to auto mode BG alert. If it's not on, press select to turn it on, and then press select to save. Have you seen this alert, sensor updating? Some people may never experience it, and for others it happens periodically. Sensor updating means your pump is performing sensor checks. In other words, your system is deciding if your sensor glucose values are reliable. There are different reasons why you might see sensor updating. Your pump will let you know that it could last up to 3 hours, but most times it will resolve sooner than that. Allow your pump to perform its checks and simply follow any instructions on your pump screen. If you find that you see sensor updating often and then you see change your sensor, you may need to check your sensor insertion sites, perhaps rotate locations, and make sure you're taping your sensor down well. Don't suffer in silence. Get help if you have questions by reaching out to the 24-hour helpline or your Medtronic representative. If you receive a CAL not accepted, look at your pump screen to confirm there's no sensor updating alert and wait at least 15 minutes before entering a new BG. Some people find that waiting longer, like 1 hour, helps. Always use a new BG after getting this alert and make sure you have clean hands, because after a second consecutive CAL not accepted alert, you'll get a change sensor alert, and we want to avoid this when possible. You might be wondering, what should I do when hypoglycemia or hyperglycemia occurs while in auto mode? When it comes to hypoglycemia, it's recommended to treat as usual using the 15-15 rule. Take 15 grams of rapid-acting carbohydrates if your BG is below 70, check your BG again in 15 minutes, and repeat if your BG is still below 70. We've seen some people find over time that they need to reduce the amount of carbs they use to treat lows in auto mode because the pump stops the basal rate as glucose levels go down. So if you notice your glucose levels going higher than usual after treating for a low, discuss the right treatment plan for you with your healthcare provider. We also recommend that you use a low alert so that your pump lets you know if you're getting low. Using this alert will help you take action when and if you need to. How about highs? If you're feeling like it's taking time for your SGs to come down to target range, you should do a couple things. First, you should address your high blood sugars, taking the steps you normally would, like check a BG and give the recommended correction. Troubleshoot your high that is not coming down by following your normal process, like checking ketones, giving an injection, and or changing your infusion set. And if it's not a set issue, but rather a pattern of highs, your settings might need to be adjusted. In auto mode, you can adjust your carb ratio or your active insulin time. Reach out to your physician for any setting adjustments that may need to be made. Also ask yourself, is your carb counting as accurate as possible? Or are you remembering to bolus before you eat? Those things can contribute to a pattern of highs. How do I manage for large meals or long meals like parties, Thanksgiving? In auto mode, there's no dual or square wave option because auto mode automatically adjusts basal insulin delivery based on your sensor glucose values. So think of it as providing little corrections over time or a built-in square wave feature. Carb counting is important, so give it your best guess and be sure to give your insulin before you start eating. Here are some tips for those meals you would normally do a dual wave bolus for. If you're eating a large meal with multiple courses, remember you can still bolus for carbs as often as you need to. Giving multiple smaller boluses instead of one large bolus works well for some people. After a large meal, you can always check your BG and see if auto mode recommends a correction bolus. Remember, auto mode may recommend a correction if your BG is over 150, but not always. It's smart and keeps track of your active insulin and basal insulin delivery. You might remember the temp target feature from your training and wonder if you should use it. Or if you do use it, when should you start and end the temp target for exercise? Remember, the standard auto mode target is 120, and you can temporarily change your target to 150. Every person is different, but in general, you could start the temp target 1 to 2 hours before exercise and end it 1 to 2 hours after. For those patients who exercise first thing in the morning, try to wake up early and set your temp target with enough time in advance, or you could set it overnight. For those who exercise vigorously and are dropping too low during exercise, you may need to consider a combination of suspending your pump and or consuming carbs to avoid the low altogether. Your temp target is designed for any time you want less basal insulin. In addition to exercise, this may include yard work, times of high stress, exams, or driving. How do you set a temp target? It's easy. Press select, select temp target, press up or down to set the temp target duration, press select, then select start. If you need to return to your standard auto mode target of 120 before your temp target ends, you can cancel it at any time. You might be wondering, are there times I should go back into manual mode? Like if you're sick, or you're going to run a marathon, your doctor prescribes steroids, or you're pregnant? Due to the dynamic insulin delivery provided by the system, it is recommended that patients initially stay in auto mode for most of these situations, except for pregnancy and steroid use. The auto mode target of 120 does not provide the titer control needed in pregnancy, and the system is not labeled for patients who are pregnant. The auto mode algorithm may not adjust fast enough to rapid changes in insulin dose requirements as seen with steroid titrations. The pump can be switched to manual mode during this time. As always, consult your healthcare professional for guidance. To manually exit auto mode, you will need to go into your options menu, select SmartGuard, select auto mode again and turn it off. Did you know when you exit out of auto mode, your manual mode SmartGuard settings like suspend before low are off? If you plan on staying in manual mode for a while, such as during steroid use, turn those settings back on. For example, you may have been using suspend before low before you started auto mode and you'd like to use it again in manual mode. To turn your suspend before low on, press select, go to options and press select on SmartGuard, go to low setup and press select. Then select the feature you want on
and press next, done, and save.
Once you're ready to restart auto mode, go to the SmartGuard setting to turn it back on. Remember, you'll need to enter a BG to start auto mode again. Now that we've covered commonly asked questions and our best tips and tricks for success, we want to leave you with some reminders. Remember to enter your carbs and bolus before all meals and snacks. Also, be sure to test your BG and calibrate the pump when it asks. Lastly, read and respond to all alerts. Performing these everyday tasks will help increase your chances of success with auto mode. I'd like to leave you with some final thoughts. Understand that auto mode is a tool and not a cure. The goal is to increase time spent between 70 and 180, but know that highs and lows will still occur. The hope is that you will experience better control with less mental work. Keep in mind the best thing that you can do is to have reasonable expectations, be patient with the system, and get help by contacting your healthcare provider or us if you need it. Medtronic is here to help you and always by your side. Thank you for your time, and I hope you found this helpful.